Hey there, welcome to Northern Soul. I was going to do I just want to do a quick video on thumb pain. So basically with the palm of the thumb here, when you're doing anything with like grip strength, so like mechanics and stuff with tools, or people that are kneading, or also like massage therapists, or anybody that has anything to do with a lot of gripping, and then you'll get some sort of pain or wear and tear, strain in this area. So the palm. So the pad of the palm or the thumb, technically called, let's see if I can get this right here, flexor pollicis brevis, which is over here, and then just underneath it, adductor pollicis brevis. So this is the movement that separates us from monkeys, the old opposable thumb, right? So does a lot of work. Mine's killing me right now, so I probably got Weeder's thumb in there with a trigger point. I'll give you some more little pointers, but I'm just going to show you quickly the typing for it. Okay, so we're going to measure it from the palm across over to the other side. There's going to be moderate stretch. So you're talking 20 to 50% stretch. I find the skin on at least the hand to be a little bit more delicate, so I don't like to go crazy with the stretch, because you'll just end up aggravating the skin. It'll become itchy, and then you'll have to take off the tape, which is counterproductive. Plus you don't need a rash on your hands, like ever, right? All right, and just rounding off the ends. If you're new to typing, go check out my video on the 101 typing. It'll describe all this stuff like cutting and all that and how it works, if you're not familiar. Also, if you're looking for what kind of tape to get, I also have two videos on comparison taping, head-to-head reviews on a lot of popular brands and some you might not have heard of. So you can check that out. I definitely recommend. So we're just going to break off in the end. I'm going to peel that back so I have something to pull on that doesn't touch the adhesive. Take that off completely. And since I'm going to be applying it to myself, see how that goes. So I'm going to open up the palm, open up the hand like that. I'm going to have one go across like this. So anchor point, no stretch, right there. Pull back to the end, right about there. So I'm just going to crimp that so I have something to pull on. And I'm going to do about 50% stretch. If you find it to be irritating on the skin, then you can back it off to 20, but a little bit more stretch is helpful. So right across like this, and then no stretch on the end. I'm just going to rub that in just to help with the adhesion. The friction makes the heat, which helps with the glue. Okay. And then we're going to make almost like a kind of a mini X. So this is tape split. They're 1-inch strips now from a 2-inch wide tape. So we're conserving tape in that way as well. So that's kind of good. So just going to pull off the end again for my anchor. And it's going to be like over here, so I get the rest of, it's actually the other muscle, because there's two of them there. And stretch, I'm going to do 50%, so you can go up to 100 and then back off to 50, and then hold, apply, no stretch on the end, same thing again, and you get this sort of crisscross pattern. So hopefully that will not catch on anything with the rounded edges. Rub that in with the to help with the adhesion. Now I could have done that a little bit longer as well, so maybe from there, just so I can get, but I mean the anchor's right there. It's going to get the most of it right there, the meat or the body of the muscle belly anyway, so that's good. So that's what that looks like, and you can leave that on for up to 7 days as long as it feels good. If it gets itchy or starts to feel worse, take it off. Another thing you can do with this area, because mine's tender to touch right now, so it's very angry. Probably got a trigger point developed right there. So at home, just bonus tips for you. With this, if you leave it on for an hour, so 10 to 15 minutes before you start going into activity, because you'll get almost maximum adhesion after 10-15 minutes. If this has been on for an hour, then you can go swimming or whatever, get it wet, get sweaty. That's fine. At that point, you could alternatively use heat on the area to help open up the blood vessels in the area to just promote more quicker healing response. Calm the nerves down as well. The constant touch, so that helps mitigate some of the pain, the tenderness that you feel within the muscle. So that's one of the other effects. You could do could use heat. So the other thing is like get it like a wash basin, or you can just like fill up your kitchen sink with hot water, and don't burn yourself obviously, but warmer than the body temperature, and just put your hands like in there for a while, and just you can even just like knead it a little bit in there. What I would recommend is if you're in the hot water, you can put some Epsom salts in there as well, just to take it to the next level. Give yourself a spa treatment, and just press right into the area that feels the worst, and just push in until you get about a pain sensation out of 10, which would be, it'll feel like a 6 out of 10 to you. So 6 to 8 out of 10 pain threshold. Hold there for about a minute, and what you'll notice is that the pain will diminish in the area. So this is trigger point therapy. After about a minute, you can just slowly release, and then if it's underwater, it's fantastic because you already got the heat going on. You can also just do it on its own as well, and then after that, you can give it a second go. It's actually safe to do a second one. So you feel that about where it hurts the most, right about there, and then you can just press right in. I'm trying to keep my thumb straight, not try to bend it. You can also use a prop, another tool, so you can grab a stone or the back end of a screwdriver or something like that and just push it in as well, so you're not like injuring your thumb or whatever. I'm just kind of used to this though. So you press in for another additional minute. Do about, once again, about a 6 to 8. I usually go up to a 6. You'll probably notice that you'll have to press harder the second time. This is good because that means that you've the pain has diminished and the muscle has relaxants. You don't have to like push, like if you can't get a 6, that's fine, that's great. If you're pushing it, you don't have to like really jam in there, but just put some firm pressure in there until you get to about a 6. If you only get a 3, great. That just shows that you've done some improvement there in the muscle tissue. And then hold for about a minute again, slowly release, and then you can like rub the area to encourage circulation. But if it's already in like hot water or that sort of thing, then you're golden. And that's like the quickest way to resolve that. And then you can just keep this the taping on there, obviously, to continue with increased circulation and then help with getting that healing response as quick as possible. Otherwise, because of the positioning of the hand, it might rub up into stuff, get dirty, so you might find yourself having to reapply a fresh tape in order to keep it nice and clean, and that's fine. So, but just be aware that might happen. So hopefully that helps. If you like that and that you find that helpful, please give us a like and a thumb up because you can now, and think about subscribing as well. The Northern Soul channel. Thanks for watching. See you next time.